Hi everyone, this is Crystal Kalari. I'm going to be presenting on postpartum depression and how it relates to cognitive and affective symptoms, including attention and memory. So, what is postpartum depression? It is a perinatal mood disorder that affects 10% of pregnant and anywhere from 15 to 20% of new mothers. It's not the same as clinical depression. It's not like clinical depression that's temporarily related to recently giving birth, um, or non-postpartum depression. It's actually physiologically different in the brain. It's different from the quote unquote baby blues, which happens to over 80% of new mothers. It usually resolves within a month of birth, but the difference with that is that the primary emotion is still happiness, punctuated by periods of sadness and other symptoms. And the percentages are even higher for women dealing with poverty, issues such as homelessness, food insecurity, job instability, things like that. Postpartum depression is one of the perinatal mood and anxiety disorders, sometimes called PMADs. They are identified in women of literally every age, culture, race, you name it. They appear during the perinatal and postpartum periods, which perinatal meaning surrounding the birth, so before birth and after birth, as well as postpartum usually up to the age where baby's around a year old. Um, Woolhouse et al. Published a study in 2014 that stated perinatal mood and anxiety disorders can appear during pregnancy or even days or months after childbirth. They do not usually resolve without some sort of treatment. They're very difficult to study as most women do not seek help due to things like shame and guilt, pressure that's put upon new moms to be happy all the time when they have a new quote unquote bundle of joy, a new family. Everything's supposed to be, hunky dory and happy. And the term postpartum depression or PPD is the term most often used, but a lot of times they could be pointing to another one of the perinatal mood disorders. There's a spectrum of different disorders. The most prominent ones are, as we're discussing, postpartum depression, postpartum anxiety, postpartum PTSD. That's sometimes related to a birth trauma. Postpartum OCD, and the most serious is postpartum psychosis. And I just wanted to make a quick note here that postpartum psychosis is always a medical emergency requiring treatment. It is not something that will resolve on its own. And both mom and baby's life is usually at risk with this condition. Some other types of perinatal mood disorders include um, clinical depression or non postpartum depression while pregnant, or general anxiety disorder while pregnant, um, postpartum acute stress disorder, and postpartum bipolar disorder. And our cognitive and affective symptoms are what affects the way that we think, feel, do our everyday tasks or our ADLs, daily living tasks. That's usually one good way to tell if someone, not only that psychologists use, but also therapists, physical therapists, doctors, to tell how bad a disease might be. Is it affecting your ADLs? So you've got, sad mood or tearfulness, confusion, lack of focus and concentration, irritability, agitation, things like trouble paying attention, hopelessness, feelings of inadequacy, forgetfulness, or that pregnancy brain, mom brain that a lot of people comment on, but it's usually to a worser degree, memory loss or suicidal ideation. I know a lot of times people are only thinking of the sadness, tearfulness, suicidal ideation, things like that. But studies have shown in uh, in women who have PPD versus women around the same age that have clinical depression who are not postpartum, that symptoms that are more often seen include lack of focus, concentration, forgetfulness, trouble paying attention, things to do with memory and attention, which we will get into, delve into more a little bit later. Detection and diagnosis can be very difficult, as many women, not only pregnant women or new mothers, are programmed to say, how are you doing? I'm fine. Everything's fine. It's great, even if they're not. And again, new motherhood is supposed to be the happiest time in their life with their new little bundle of joy. It's very often missed by OBGYNs early on. Um, to put it in perspective, usually a woman's first postpartum visit to the OBGYN is usually 6 weeks after birth if she hasn't had any other physical complications. Um, so oftentimes it's not diagnosed until they see the doctor until almost a year later, and mom realizes she's been feeling terrible for all this time, or perhaps her GP or PCP might catch it in that time as well. Um, Very few studies have been done, although there are markers during pregnancy. But pregnant women are very difficult to study. I know, especially if you've taken a research methods class, that they are a protected, especially protected class under international review boards. So it requires all sorts of extra things. And pregnancy is a limited time. It's only 9 months, obviously. Um, and pregnant and new moms are busy, scatterbrained, even in the best circumstances. They don't have a lot of time to dedicate or to the longevity to stay in the study. But the most useful tool in detection and diagnosis is the Edinburgh Postnatal Depression Scale. I'm sure a lot of you have heard of the Beck Depression Index. This is different as researchers found that many of the questions on the Beck Depression Index, such as appetite changes, weight loss or gain, loss of sleep, or sleep disturbance, could be explained simply by just having been pregnant or giving birth, being a new mom. So that's one of the reasons the Edinburgh Postnatal Depression Scale was created. Here's some of the questions that it has. And then here's the explanation of how to use it, scoring, and a little bit more information. Along with this, I did mention earlier, there is a 2008 study that found that some symptoms are more prominent for PPD versus non-postpartum depression in women of the same age. And again, another one of the reasons that a scale like this is more helpful for detecting postpartum depression versus non-postpartum depression. And in that study, researchers found that the most common symptom in non-postpartum depression was sad mood, reduced interest, suicidal ideation, all very common symptoms of clinical depression. I'm sure we have all gone over. But the most prominent in postpartum depression were impaired concentration and decision making. And this was in that 2008 study by Bernstein et al., which was done at Yale University and the University of Texas. I know a lot of us have probably heard of pregnancy brain, mom brain, where you're forgetful. You see the memes of pregnant women sticking their keys in the freezer and their lunch, in the car, things along those lines. But the symptoms with PPD have been shown to be worse: impaired concentration, having trouble focusing, paying attention, as well as impaired decision making, all which are troublesome, especially when you've got a new baby to take care of. So risk factors of postpartum depression. The number one would be a prior history of mental health concerns such as anxiety and depression. There's also circumstances surrounding the pregnancy. Was the pregnancy planned? Was it quote unquote wanted? Um, was it really, really wanted and involved a lot of fertility treatments that were exhausting, and mom is now really worried about losing the baby? Has she had a prior termination, miscarriage, another loss, things along those lines? Is there something pressing around the pregnancy that is causing extra stress? Another is husband or intimate partner domestic violence, medical issues, lack of access to prenatal care, either due to transportation or finances or other issues, situational stressors, as I mentioned before, poverty, financial issues, marital or relationship distress. Was the relationship already in trouble and then the woman got pregnant, not expecting to? A limited support system, strained relationships, not a lot of supportive friends or family, or are they quote unquote making her keep this pregnancy and it's not what she wants? Um, a Danish study in 2013 by Metzler Brody et al. Found that the second bigger risk factor following a prior history would be prior childhood trauma, usually involving familial disruption. So if the child did, or if the mother at the time when she was a child, either her parents got divorced, a parent passed away, or any circumstances involving her not being raised by both parents, along with any sort of child abuse or sexual trauma. What causes postpartum depression? There's so many different contributing factors that researchers and doctors don't know exactly, because again, it's very difficult to study. Inadequacy during pregnancy has been one theory. Those prenatal vitamins that pregnant women take are not just for the baby; they're helpful for them as well, including things like DHA, which we know is good for baby's brain, but also good for mom brain's function, like memory, cognition, emotional processing. Then we have tryptophan and 5-HTP, all involved in producing serotonin, which is our happiness hormone, as well as iron, which helps metabolize dopamine, which is our pleasure hormone, as well as hippocampal structure and function. And then you've got surging oxytocin during labor and delivery, and then big hormone crash post-birth of estrogen, progesterone. A lot of doctors, researchers think it's just a perfect storm of neurotransmitter and hormonal changes combined with a lack of sleep, the stress of a new baby. It's all can be combined in different causes for different women as well. In terms of brain chemistry, the quote unquote love hormone oxytocin that stimulates the release of GABA, which suppresses anxiety. That's normally mediated by physical contact with the baby, having skin to skin contact, things like that. So less oxytocin equals less GABA, which means more anxiety and depression like behaviors. What causes PPD in terms of neural activity? A weaker connectivity has been found among the amygdala, anterior cingulate cortex, dorsolateral prefrontal cortex, and hippocampus, which work together for emotional processing, attention, decision making, memory, more specifically, working memory, selective attention, and the right amygdala region specifically in response to negative stimuli.